Welcome to the Lower Back Pain and Sciatica webinar. I will be your host today, and the webinar is full and is officially closed. Try not to leave because you will be locked out. So let's begin. Has anyone had back pain or sciatica in the last 30 days? Does anyone have back pain or sciatica right now? More than likely, if you're on this webinar, then you probably have, or you know someone who has it currently or has had it in the past, and you want to try to help them. So let's get into exactly what the sciatic nerve is. The sciatic nerve, as you can see here on the picture on the far left, the green area is your sacrum, and you can see how the sciatic nerve actually runs right down through that area. Now, on the picture on the right, I have removed the sacrum, and you can see how there's smaller nerves that come off from the bones above it, and those are your lumbar vertebrae, actually right around L3, L4, and L5. And then coming out of that sacrum, that green area again, S1, S2, S3, you have those small little nerves that come out of your spinal cord there and then form into a really big, thick nerve that travels all the way down your leg. So you can see by the area that I have circled here, those lumbar vertebrae are right above that sacrum, and the nerves come out of there, travel through the posterior portion of your hip and your buttock, travel down the back of your leg. Sometimes you can even feel it in the front of the thigh, goes down the back of the knee, down to the lower leg, and sometimes into the foot. The sciatic nerve is actually the largest nerve in the body. So to kind of give you a common analogy to continue to help give you a better understanding, we're going to use a TV as an analogy. So we're going to think of the electrical outlet as the spinal cord. And so that electrical outlet has all the power coming in, or the spinal cord has all that power and electrical signal coming into it. And then you have the power cord, the little black line, the little black cord there, which would be your nerve. So the nerve coming out of the spine and going towards what we would have going into the back of the TV, and actually going into, we're going to use the analogy that the TV is a muscle. So now you have all these different little wires coming into that muscle to help that muscle contract. So that's right as it starts to enter the muscle. Then it's going to go into that muscle and it's going to cause that muscle to contract, or in the TV analogy, it's going to actually make that TV turn on. So we have that nerve-muscle connection. So again, to kind of break that down, we had that electrical outlet where our spinal cord was, that carries all the signals from the brain down the spinal cord out into the cord for the TV, which is the analogy of the nerve, which then goes into the back of the TV, where it actually is that very point where that nerve enters into the muscle. And then you have the muscle and its contraction, which is actually that HD or your TV that you're using now. So hopefully that helps to break it down a little bit clearer for you, so you have an understanding and kind of can relate that to your everyday life. Now, have you ever had a garden hose and you're using your garden hose to wash the car and you notice that it loses some pressure in a certain area? Well, that's kind of the same thing that we do with the sciatic nerve. So that sciatic nerve, if it gets pinched somewhere in your lower back area or in the hip, then it can create a tingling or a numbness or a weakness sensation in a particular portion of your low back or the back of your hip and your foot, leg, wherever. It just really depends on where it is being pinched. So what do we do there? Well, with the water hose, we actually unkink it, and with the body, we do the same thing. We find out where that kink is, if it's bone that's compressing it, if it's disc that's compressing it, or if something is out of whack or out of alignment and it's creating more tension, then we try to find that and we then correct that. So now we're going to make this a little interactive. I want everybody to stand up. If you're at your computer, or if you're watching this on your iPad or your phone, go ahead and stand up. And I want you to bend forward and touch your toes. So I want, now, does anyone have any type of pain with this? If you do, go ahead and write that down, that you had pain when you were bending forward. I want you to write it down where exactly your pain is, and write down on a scale of 0 to 10, 10 being the worst possible pain you can imagine, 0 being you have no pain at all. I want you to write down your level of pain and where it is at when you bend forward. Now, the next move you're going to do is you're actually going to put your hands kind of in the small of your back, and you're going to bend backwards. Do you have pain with this movement? If so, I want you to write down where that pain is exactly, and again on a 0 to 10 scale, what level of pain that you are having. Next, I want you to bend side to side. So you're going to stand up, your hands are by your side. You're going to try to side bend over towards your right knee, and then back up. And then you're going to side bend over towards your left knee. Do you notice any pain there? Any difference in your motion or your movement when you go into that direction? If so, I want you to write that down, which side it bothered you bending sideways to or side bending to. Write that down. And at the very end, I want to ask you to email me and let me know where exactly that pain was, and we'll see if we can't get you some help. So let's meet me. I'm Kevin Koska, and I'm a doctor of physical therapy. I have got 4 degrees. I graduated physical therapy school with my doctorate of physical therapy in 2003. I got a master's in physical therapy, and then prior to my postgraduate work, I received 2 Bachelor's of Sciences degrees, 1 in psychology and 1 in rehabilitation science. When I first got out of school, I was very interested in the shoulder, and so I studied it extensively and actually wrote a book on the shoulder and have co-authored a paper, a journal article on the elbow as well. So that was my first interest. I recently have experienced my own. When I first got out of school, I was just taught just enough to pass the boards. So what I was finding is that after about 3 to 4 years of experience, I was only getting about 50% of my back pain patients better with what I was taught in school. And that is just not good enough for me, and it just wasn't good enough for my patients. So I took it upon myself to start to study the back a little more extensively. So I started doing a lot more research on different classifications of back pain, as well as different treatments for back pain. And one day I was working out with some friends, and I started to experience my own back pain. I went through the treatments that I was taught in PT school, and I'd get a little better for about 4 to 6 weeks, and then my back would quote unquote go out on me again. I'd be down for 4 to 5 days with some pretty bad pain, and then it would start to loosen back up and I would be able to continue to go back to work. But that just kept recurring over and over again. So I ended up going to an orthopedist, a spine specialist, and they wanted to fuse my spine. I wasn't ready for that, so I went to get a second opinion, and this guy kind of told me the opposite thing. He said that, oh, it's a disc and we need to take the disc out. So after having 2 different answers, I went to a third doctor. Now, they all had x-rays, they all took x-rays, and they had the same MRI. And this doctor was like, you know what, listen, your spine looks just as good as mine does. Why don't you just keep doing what you're doing? So I really wasn't happy with or satisfied with those 3 answers. So I took it upon myself to do some further study with some other physical therapists and came across some osteopathic type techniques. You may know the doctor of osteopath. You may have one as your primary care, but basically they are an MD. They can prescribe medicines for you. They can prescribe physical therapy for you. And they are often taught other types of manual or hands-on techniques to help patients as well. So I started studying these techniques, and what do you know? I was able to completely resolve and abolish my back pain with these particular techniques, and I have since put them into practice and am successfully treating back pain patients at a 90% success rate now. So we know that 90% success rate because we perform functional outcome scores using some outcome measures that insurance companies like to use and that have been validated. So we take those at the very beginning and then again at the end of the treatment to see how well you have improved. So, is there hope? Well, how can we tell? Well, how can we tell if you're going to be able to naturally heal yourself? Well, the first thing that we want to do are see what activities actually make your pain worse. So if there's a particular activity that you tell me or that you notice that makes your back pain worse or increases your back pain or helps to relieve some of your back pain or some of the symptoms that go into your hip or down your leg, well, that tells me a lot of information. So some activities like standing or walking, activities like that will tell me a lot of information. Or if sitting makes your back pain worse, or if sitting makes your back pain better, if bending forward or leaning backwards, depending upon what movement it is that you tell me or that we look at that increases or decreases your back pain, well, that gives me a lot of information and can actually help me come up with a treatment for you. So, have you had, as we went back to the very first slide, have you had back pain or sciatica in the past 30 days? We're going to use that same scale we discussed earlier when I had you stand up and bend forward and bend backwards. That's a 0 to 10 scale, and the 10 is the worst possible pain you can imagine, and 0 is no pain at all. So I want you to write that down. If you didn't do it the first time, write down that 0 to 10, and write down whenever you felt that pain come on. And if you don't quite remember, then be a little more mindful or aware of when that back pain does come on. And refer back to that list that we had mentioned earlier and see if any of those activities caused you pain. And if you answered yes to some of those, then there is hope for you. We can most likely help you. So, there's one saying that we like to use in the clinic, and that's if your pain is reproducible, then it is often reducible. So if I can increase your symptoms with certain movement patterns or certain techniques, then I can typically reduce your pain complaints with certain movements and techniques as well. So that's good news. When the pain is reproducible, then we know that there is a cause for it. And then when there is a cause for it, we can handle it. So there is hope. What if your pain is not brought on by any of those activities that we spoke about, like bending forward, leaning backward, sitting, standing, walking? What if it doesn't seem to have any rhyme or reason? Well, I want you to reach out to me afterwards. PT may not be the answer for you, but I can always help lead you to the right healthcare professional to help to get you answers. So I'm here to help. So that's what we're trying to do. So what is the most common mistake that people make in handling their pain? They ignore it. So when we have pain, we have three choices. We can either ignore it, we can try to alter it, or we can actually try to handle it and change it. So your choice number one, ignoring the pain. That's usually the easiest and the most common mistake that I see in my physical therapy practice. People have ignored their pain for years, 2 years, 3 years, 5 years. I've even had, just as of last week, I had somebody tell me that they had low back pain for 20 years. And it's just getting so bad now that they finally wanted to do something about it. So he told me that he just kept making excuses for it. Oh, I'm always going to be this way. I don't have time to do it. I was just too busy. My back pain runs in the family. They got caught up on what their MRI said, that they had a bulging disc or something like that. I mean, there are millions and millions of excuses on why people try to just ignore their complaints. So I will say this. I have seen over 10,000 patients while I've been practicing. And one 80-year-old doesn't look like the other 80-year-old, or one 30-year-old doesn't look like another 30-year-old. So why do some people in their 80s move much better than the others? Could it be genetics? Sure, there could be a small role in it. Is it a magic pill? Probably not. But to me, it's the way that they take care of themselves. And usually if you take care of yourself, then it's the way that you handle any types of problems that come your way, or any types of situations that come your way. It's not by ignoring your complaints. It's by actually taking action and being cause over fixing what is going on. So if you actually try to handle these things and you find the right person to help you, then you're going to be able to have a good quality of life up. So choice number two, trying to alter your pain without addressing the root cause. So this is somebody that might be taking pain pills to help numb the pain, or somebody that uses a hot pack or a cold pack to try to help loosen themselves up. It may help temporarily, but you're not addressing the root of the problem. You're not addressing what is causing the problem. So the pain, like I told you earlier, will eventually return. All I was doing is, when I was treating myself, was going through some of the treatments that I was taught for 2 other types of injuries, and it would temporarily get better, but then it would come right back. So if you're looking for a long-term permanent solution to a healthier spine, a healthier low back, then you need to address the true root of the problem and what is causing the pain. So that leads us to number 3, and that's handling your pain. So by finding what the root cause is, by finding out what the right treatment is, that is what's going to get you the permanent results that you're looking for. As physical therapists, we are specialists in low back pain. We're specialists in the human body and the way that it moves. So we are able to look and figure out exactly what the cause is of your low back pain and develop a specific treatment plan for you that's based on research and evidence to help get you the best value and the best results. So I have a question for you. Think of the worst pain that you have felt in the past year. How did you handle it? Did you ignore it? Did you take an Advil or an ibuprofen and just move on? Or did you try to get the right help, find the root of the problem, and go and handle it? So, what is the best treatment for your pain? There are many, many different treatments available for back pain and sciatica. You can go online and find hundreds and thousands of different things to do. In physical therapy, we use research. We use an evidence-based practice to help select what the best treatment is for you. What has worked on thousands of others that they have found in the research will work for you. So it's a matter of just finding out what the cause is of it and working through it. So let me tell you a little short story about a ceiling tile in my first clinic. So we had a little reception room right as you walk into the glass doors there, and in the reception room we have some of those white tiles that are up on the ceiling there. Me and my buddy me and another employee walk in and see the tile above, and we see this huge dark brown water stain on it. So we go and tell the people that own the building and say, hey, I think there's a leak in the ceiling there. There's the tile has a water stain on it because it just rained last night. So what did they do? They ignored it for the next 2 weeks. And so that stain just got a little bigger and a little bigger. What they then came in to do as it got a little bigger is they put a bucket up there to catch the water that was coming down. And every week or so they would come and change the bucket out. I kid you not, that really happened. So they were basically just ignoring what was happening until the next time they came in, they actually tried to alter it. So what they did is they just brought in a new ceiling tile. So now we didn't see the water stain up there until we had rain for about 3 weeks, or about 2 weeks in a row. It rained off and on for about 3 weeks, and we had some pretty consistent rain. And next thing we know, we come into work the next morning, and the tile had so much water on it, it finally gave way and fell and busted on the floor, and there was that white tile-ish stuff all over the place. So that was nice to come in at 7:15 and have to clean up before patients started rolling in at 8 o'clock. So what did they do? First they ignored it, and then they tried to alter it. They never really tried to fix the root of the problem. So about a year later, they came in and actually brought in somebody to get on top of the roof and find out where the leak was coming from. And you know what? That ceiling tile is good to go to this very day. So now that we've kind of given you the 3 ways that people handle problems, now let's get into the 3 most common causes of back pain and sciatica. Why is it important to find the exact cause of your back pain? Well, We talked about this earlier, right? If we don't find the root cause of it, then you're not going to receive the proper treatment of it, and you're not going to get that relief that you're looking for. You're going to have that pain come back to you. So we see a lot of back pain and sciatic sufferers who have failed treatments in the past. They have had failed surgeries. They've had injections that only worked temporarily. They had to be put to sleep and get an injection, and it only helped for a week or so. They've had chiropractic care. They've had physical therapy at other facilities, and sometimes physical therapy or chiropractic care over a course of a year or 2 years, and they haven't gotten better. So what we look for is finding that exact cause of your pain and trying to help get you the proper treatment for it. So, does this sound like you? Let's take a look at the 3 most common causes of back pain and sciatica. Oh yeah, and by the way, we see a lot of people who make the error of being fixated on the results of an MRI or X-ray. All my patients want to come in and say, yeah, I had an MRI, I had an X-ray, and it showed this. I want you guys to keep an open mind to this. Now, there's a research study out there, and it shows that MRIs and X-rays don't always tell you the whole picture of exactly what's going on. You could take an X-ray or an MRI of 100 different people, and 3/4 of them are going to show up that they've got something wrong on their X-ray, and they don't have any pain at all. So there's going to be some mixed reviews out there about MRIs and X-rays. So let's talk about cause number 1, and let's talk about the herniated discs, and let's get into what a disc actually is. So if you look at the picture on your left, you can see the nerves, those little yellow structures. Those are the nerves that are coming out of your spinal cord. You can see the vertebrae or the bones there, and in between those little bones you can see that thin layer of white, and that's what the disc is, and that's actually a shock absorber for your spine. And the disc is kind of there's a little part, and on that picture on the right you see that blue part, and that's the nucleus pulposus, fancy word, but that's basically the inside portion of that disc. And that disc is made out of like a gelatinous type material. So it's about 90% water, 10% gelatinous type material. So it's almost like toothpaste. And that toothpaste is in that inside area there, and it's surrounded by that white area that is a bunch of different types of fibers that are running in perpendicular directions to each other. So how do we know that you have a positive sign of a herniated or a bulging disc? Well, or a protrusion. There's a lot of different words that are out there, but we're just going to use one term and kind of lump them all together for that herniated disc. So that picture there you see that disc, how it's the red area and how it's pushing towards that back side there. Typically it'll go to one side or the other, and depending upon what side it's touching, which nerve it's touching, that's where you'll feel those symptoms in the front of your leg, back of your leg, foot, etc. So people that have pain when bending forward or with twisting or lifting, sometimes coughing or sneezing will cause or will be certain characteristics that we look for people that have disc herniations. Oftentimes it's 35 years of age or younger that have herniated discs, because that's whenever those discs are more pliable and more moldable and move around. Oftentimes we'll see relief with standing or bending backwards. We'll often get pain relief. Are disc herniations common? Well, as I referred to earlier, if you took an MRI of 100 random people that didn't have back pain, how many of them do you think would have a herniation on their MRI? I said about 3/4 of them. So right around a little bit more than 3/4. 80% of those people that have disc herniation or bulges on an MRI have no pain at all. So that means that disc bulge, it could or could not be causing what your pain, if that's what they're seeing or that's what you've been told on an MRI. So it basically just means you cannot solely rely on an MRI or an X-ray to determine what the cause is of your back pain. I see it over and over and over again. People coming into the clinic saying, my MRI says this, my X-ray says this. And I listen to it, acknowledge it, but at the same time, I want to see what movements are causing your pain, and that's going to give me a lot more information on what the root cause of your pain is. So when we're still talking about the disc, repeated stress and force from bending forward and lifting repeatedly with bad form, using your back to lift, trauma like a car accident, these fibers can be broken through. It allows some of that gel-like substance to push out either to the left or the right, or down the middle, and puts pressure on the nerves or the spine. That pressure, once it starts pushing against the nerve, depending upon which nerve and where exactly on the nerve, will cause the pain or the numbness or the tingling or even weakness in the leg. So when this happens, the back pain or sciatica sufferer can usually take their finger and kind of trace right down the leg where that pain goes and where it's coming from. Typically that's about the L4, the L5 area for the disc. Again, it depends on the age, exactly where it's coming from. So that's number one. So cause number two, degenerative disc disease, arthritis, or stenosis. So let's get you a picture here so you can kind of see how all that works. Here's how it works. You have your spine again, and then in between those spine you have a certain height that disc should be. As we start to age, we start to lose that water inside those discs. So those discs start to shrink down. That space gets smaller. And when that space gets smaller, that nerve doesn't have as much room to move around in there freely, so that hole gets smaller and the bone will actually push down on that nerve and cause some pain. So anytime that nerve gets compressed, like that water hose, that'll send that pain signal down into the leg wherever that nerve is compressed in the back. So, positive signs that you have degenerative disc disease or arthritis. Usually that's 50 years of age and older. You're going to have pain with standing or with walking, because when you stand, gravity is pushing down on you, and that pushes down on that disc, and that pushes those bones closer together, which then pushes down on the nerve. You often will get relief with sitting down. I often see people in the grocery store using a cart, and they're leaning forward on the cart. And that's actually, when they're leaning forward, they're trying to make more room for that disc and for that nerve. So that actually is a sign of some stenosis or that degenerative disc disease. Those people can be helped as well. If you've identified with these three items, pain with standing and walking over the age of 50 years old, and the pain is better when you sit down, then there's a pretty high chance that you have something called degenerative disc disease or stenosis. When you bend backwards, when you're standing or when you're walking, again, that hole gets smaller, puts pressure on that nerve, and that sends that tingle or that zing down the leg, or it intensifies that pain that you're having. When you lean forward or sit down, again, that makes the area for that nerve, makes a bigger area for that nerve, and it takes pressure off the nerve, and you might get a decrease in your pain relief. So in short, yes, you can be helped if you have that type of back pain. Now, the number 3 cause, and this is a tricky one because it doesn't show up on an X-ray or an MRI. It's often missed and even misdiagnosed, and it is called SI joint pain. So again, let's get you a picture of what that looks like. Here in the green, you can see the sacrum in the middle. You can see the 2 hip bones on the side, and those are called your iliums. So it's called your sacroiliac joint, or for short, your SI joint. And that can get kind of twisted or out of whack there, and can then cause tension on your sciatic nerve and cause some pain in your back, in your hip area, down into the leg as well. So we basically look at that sacrum as the bottom block. That bottom block is very important to be stable and be in the right position so it holds the rest of the blocks on the way up. We actually call that the keystone. The sacrum is the keystone for your spine. So that's why it's the most important block in the spine. It's the foundation. It's basically where all the other bones are going to sit. Now, the SI joint in the very front is called your pubic symphysis, and that's actually where the 2 iliums kind of come and attach there. The 2 joints in the back, as I mentioned earlier in that green picture, is your sacroiliac joint, or we might call it the SI joint when you're in the clinic. The 3 joints need to be moving and need to be very stable, and they need to be stable so that you don't have pain, and so you can get back to a normal function. But sometimes that ilium can get rotated, or it can slip up, or that sacrum can get stuck whenever you bend forward or bend backwards. So those are some hands-on techniques that we look at and try to measure, and that's how we go about finding out if it's your SI joint. If it's not in the proper position, as I mentioned earlier, it can put pressure on that sciatic nerve and start to cause some pain going down into the leg, or that pain can just be in the low back area. So I often hear people say that they have real pinpoint pain just on one of the bones, one of the big hip bones that sticks out in your back. They will sometimes complain of pain with changing of positions, and what I mean by that is from lying down to sitting, or from sit to stand. They may complain that it feels like it gets locked on them, or it gets stuck when they're transitioning from a sit to stand. Getting in and out of the car, they may make some complaints like that. Sometimes you may get some pain and tingling and numbness in the legs, maybe down the side of the leg instead of the back of the leg. There's a lot of different complaints, again, that we get, and this can be of all different ages. It can be of a young population. It can even be in an older population. So we don't want to just look at the disc or the stenosis or arthritis, but we also want to look at that SI joint and make sure that it's in proper alignment, and that you don't have any problems going on there. So if you have suffered with back pain and sciatica, you've tried different treatments which has or have not worked for you in the past, or currently, then there's a good chance that you might have an underlying SI joint problem. So if you have been able to relate to any of these scenarios, just reply in the comment section down there, and we'll see if we can't help you find what a successful treatment would look like. Okay? So the key to successful treatment is finding the cause of the pain and assisting the body with the ability to heal without using medications, injections, or surgeries. So we use 4 different phases of rehab in our practice. So the first one is to reduce the pain and the inflammation. We try to regain range of motion or maintain your range of motion while we do that in that first phase. That first phase may take us anywhere from 7 to 14 days. The second phase we start to move into is a hands-on phase. And that's where we'll often do this initially, and this within the first couple visits, we'll start trying to do some mobilizations or some hands-on treatments to try to either get that open the space for the disc, or if you got that stenosis or arthritis, we try to open it up a little bit. If it's that SI joint area, then we try to do some muscle energy techniques and try to get that back into a better alignment, getting some muscles to calm down, getting some muscles reactivated. So we go into a little bit of strengthening and then get into some flexibility. Then that third phase, we start to get you back to life, work, and sport. That's usually about week 4 through 6. And then we try to start educating you on injury prevention and how to maintain the current state that you're in that final phase there. So the formula for the permanent pain relief, I tried to write down some things here to kind of help you get a better understanding. And we need to put out that fire first. So we need to rule out other causes, and we need to correct any type of SI joint as well as any type of hip restrictions. More than 80% of our lower back pain cases, they start seeing a reduction of their pain complaint on that 0 to 10 scale in 6 visits or less. So we'll actually start to notice something in about 2 weeks. Then we start to continue to improve the mobility of the hips, of your thoracic spine, so the spine right above the lumbar area, so your mid-back area. We continue to mobilize that SI joint if we need to restore the normal movement there and start to get that lumbar spine in the right position. Then we start doing corrective exercises in order to get some muscles to shut off that were in a spasm and get the opposite muscles to start to contract properly again. We might stretch some tight muscles, and then we might get into some neuromuscular re-education where we're retraining the brain and the nerves to make the right muscles contract during particular movements. If you had been altering some of your movements because you were in pain, then you start to learn techniques to try to get around that pain. So again, we start to activate and try to inhibit some certain muscles that may be causing some problems. We would address the herniated disc and the stenosis issues, either or, once we get that SI joint cleared and back into normal function. We'll then start to integrate some type of functional activities where you're on your feet, and activities like sit to stand or lifting or pushing or pulling, activities like that you need to be able to get back to your normal everyday life at home and work or your sport. We'll also teach you how to do these techniques on your own once we get them into a manageable area, so that if the pain does come back again, you know how to correct it. And then we start to transition you into a home exercise program so that you can continue to do these activities on your own at home. And finally, communication. Communication is very important. It's important to communicate back to your treating therapist, and for your therapist to communicate to you on what exactly you're doing and why you're doing it, what progress you've made, what you've done different, in order to help you realize that you are making these incremental gains. And sometimes over 1 week or 2 weeks, it's hard to see huge gains, and you might get disappointed. But ultimately you are making gains, and your therapist will typically help show you that on each visit or every week or so. They'll help show you that. So communication is important. Hey, I'm doing this and having a hard time with it. Not able to do my exercises at home. I don't understand this. So that's always very important to make sure you communicate. And email us and let me know what it is that we can help you with there, which one you think you have, and we can shoot you a video and send some exercises over there for you. So if you have any questions down here, please put them in the list below, and I'll try to personally reach out to you and see if I can't answer some of your questions. So today we're going to do something that we typically don't do. You've listened to me babble for 45 minutes about low back pain and sciatica, so I want to do something for you since you sat through this. I want to offer you a free screening session. I want to offer this to you so that you can help find what the true root of your problem is. My purpose is to be able to help people. That's why I'm here. So I want to be able to help you start handling your back pain and your complaints so that you can get back to your normal life again, so you can play with your grandkids, so you can go hiking or go to the gym and work out. I want you to be able to get back to doing the things that you love and quit wasting money on medications or injections or things that aren't really going to cure your problem. So we've reserved a few openings this week and next week. Unfortunately, we don't have 50 slots available for everyone. So we had 30 people register in the Chattanooga area today, and we should have about 20 spots available, it looks like, when I'm looking over my schedule here. So in order to reach out to us within the next 24 hours of this webinar, I need you to call this phone number that you see here, 423-777-4974, and get scheduled for a free